For more on this battle over reopening and what those new projections of cases and deaths could mean, we want to turn to Dr. Scott Gottlieb. He's the former commissioner of the FDA, a CNBC contributor. Dr. Gottlieb, good morning. It's good to see you. You know, let's talk about these projections. There was a draft that came out of Johns Hopkins, and we can almost set it aside because the author of that draft said it really wasn't ready to be released. But at the same time, you have the University of Washington, which is often cited by the administration, revising its projected death toll to 135,000 when it was 70,000 a couple of days ago. So the trend is obviously in one direction. What do you make of it?
Well, look, we still have a high level of infection in this country. We've reached a plateau, but we haven't seen the kind of declines that we were expecting to see at this point. And as we start to reopen the country, cases are likely to go up, not down. We're likely to see those case counts start to increase. The mitigation steps that we took were an attempt to try to prevent the healthcare system from becoming overwhelmed, and they worked to do that. The hospitals never really became overrun, but they were a bridge. They weren't a solution. They're not going to end transmission of this virus, but we did think that we'd be at lower levels at this point when we started to contemplate reopening aspects of the economy. And so as we go through May, we're likely to see the case count start to creep back up again.
That's what I'm trying to understand here, because we all remember, I believe it was in late March, when the White House said we could see a death toll of 100 to 240,000. Then a few weeks later, members of the administration, Dr. Fauci, the modelers, I mean, everyone would seem to agree. We think we can get it lower. Now we're already at 70,000, and now we're seeing projections go way back up again. So, I mean, what's the bottom line? Did social distancing really not get it done to the extent that was expected?
It depends on how you're assessing it. In terms of flattening the curve and preventing the healthcare system from becoming overrun, it worked very well. In terms of forcing the epidemic to really peak and then start to decline, we've really been at a sustained plateau now for about 30 days. And so we've been at about 30,000 new cases a day and 2,000 deaths for an extended period of time. We haven't started to see the declines that we expected to see right now. But remember, modeling is imprecise, and that's why we shouldn't put stock in any one model. It's not like forecasting the weather where you make a prediction and then you see what happens. You make these predictions and then you take actions based on those predictions. And so you're affecting the outcome based on the model results that you're getting. So we took certain actions. We got more stringent based on those early models that showed very grim forecasts. Some of those didn't come to pass. I think what we expected to see at this point, though, and certainly I expected, was that we'd see sustained declines in new cases around the country. And once you back out New York, where you really have seen those sustained declines, around the rest of the country, cases are actually going up. There's about 20 states where cases are going up on a daily basis, and so are hospitalizations.
Well, that's what's kind of surprising about all of this. I mean, you said, no question, the mitigation worked, so the hospitals weren't overrun, healthcare workers weren't overrun. Granted, they have had to deal with an unprecedented amount of sickness and disease. But at the same time, you're also saying we're actually not seeing those declines. We're seeing a plateau or even going up if you take out New York, which was the epicenter.
That's right. And I think that we need to understand this may be the new normal. We may not be able to get transmission down much more. I hope we can. But as we reopen the country against this backdrop where there are tens of thousands of cases a day, most likely scenario is that cases go up, not down. And so we need to think about what it looks like in the country if we have transmission of this virus and we try to get back to some sense of normalcy. And I think it means we have to protect vulnerable populations, which end up being disadvantaged Americans, people who work in conditions where they can't socially distance. That's why you see outbreaks on shop floors like meatpacking plants. So we've got to get personal protective equipment into those settings so people can protect themselves at work. We need to think about the places of vulnerability where if you have this virus continuing to spread, there's going to be certain populations that are more vulnerable to it, and we need to do more to protect them.
Yeah, we just got to be so careful, don't we, Doctor? Thank you so much for your time this morning. We really appreciate it.
Thanks a lot.